Diabetes and heart health, a link to understand. When you think of diabetes, you might picture blood sugar levels that are too high. But did you know that these high blood sugar levels can also increase your risk of developing cardiovascular disease? The link between high blood sugar and cardiovascular disease is not well understood, but researchers have identified several potential mechanisms that may be responsible. For example, high blood sugar levels can cause damage to the walls of blood vessels, making them more likely to develop plaque buildup and narrow over time. This can lead to atherosclerosis, a condition in which the arteries become hardened and less flexible, making it harder for blood to flow through. In addition, high blood sugar levels can cause inflammation throughout the body, which can contribute to the development of atherosclerosis and other types of cardiovascular disease. This inflammation can also increase the risk of blood clots, which can lead to heart attacks and strokes. There is also evidence to suggest that people with diabetes may have changes in their blood lipids, cholesterol and triglycerides, that increase their risk of cardiovascular disease. For example, people with diabetes tend to have lower levels of good, HDL cholesterol and higher levels of bad, LDL cholesterol and triglycerides. Diabetes can also cause changes in the structure and function of the heart itself. For example, people with diabetes may experience thickening of the heart muscle, which can make it harder for the heart to pump blood efficiently. They may also be more prone to developing heart failure, a condition in which the heart is unable to pump enough blood to meet the body's needs. Research has shown that people with diabetes who maintain tight control over their blood sugar levels have a lower risk of developing cardiovascular disease than those who do not. This is because controlling blood sugar levels can help reduce inflammation and prevent damage to the blood vessels. Lifestyle changes such as healthy eating and regular exercise can have a significant impact on diabetes and heart health. Research has shown that people with diabetes who make lifestyle changes are able to better manage their blood sugar levels, reduce their risk of developing cardiovascular disease, and improve their overall health. Healthy eating involves consuming a balanced diet that is low in saturated and trans fats, added sugars, and sodium. A diet that is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce inflammation and protect against cardiovascular disease. Regular exercise is also important in managing diabetes and protecting heart health. Exercise helps the body use insulin more efficiently, which can help lower blood sugar levels. It also helps reduce inflammation, lower blood pressure, and improve cholesterol levels. Other lifestyle changes such as quitting smoking and reducing alcohol intake can also have a positive impact on diabetes and heart health. By making these lifestyle changes, people with diabetes can reduce their risk of developing cardiovascular disease and improve their overall quality of life. Managing diabetes medications is essential in reducing the risk of cardiovascular disease in people with diabetes. Medications such as metformin, sulfonylureas, and insulin can help control blood sugar levels and reduce the risk of developing cardiovascular disease. Research has shown that some diabetes medications, such as GLP-1 receptor agonists and SGLT2 inhibitors, can also have cardiovascular benefits beyond their effects on blood sugar levels. These medications have been shown to reduce the risk of heart attack, stroke, and heart failure in people with diabetes. However, it is important to work closely with a healthcare provider to ensure that diabetes medications are being used safely and effectively. Some medications may need to be adjusted or discontinued based on individual health needs and the presence of other medical conditions. By effectively managing diabetes medications, people with diabetes can reduce their risk of developing cardiovascular disease and improve their overall health and well-being. Regular monitoring of blood sugar levels and cardiovascular health is also recommended to ensure that any necessary adjustments to medication are made in a timely manner. Future research directions for understanding the link between diabetes and heart health are aimed at identifying new approaches to prevent and treat cardiovascular disease in people with diabetes. Some of the areas of research include the development of new medications that can help lower blood sugar levels and protect against cardiovascular disease, as well as the exploration of the impact of genetics and epigenetics on the development of diabetes and related complications. Other areas of research include the use of technology to improve diabetes management, such as continuous glucose monitoring and artificial pancreas systems, as well as the investigation of the role of the gut microbiome and the immune system in diabetes and cardiovascular disease. By continuing to invest in research, we can gain a better understanding of the link between diabetes and heart health and develop more effective strategies to prevent and treat cardiovascular disease in people with diabetes.